Welcome, Professor Jakob Itzbicki, to the ACS COVID-19 interviews from the front lines. Professor Itzbicki is first and foremost an honorary fellow of the American College of Surgeons. He is the chair of surgery at the University of Hamburg. He's past president of the European Surgical Association. Welcome, Jakob.
Welcome.
So one of the things that many people have questioned is why Germany is doing better than all the surrounding countries, Spain, Italy, France, in terms of mortality, in terms of the degree of illness of patients with COVID-19. The incidence doesn't seem terribly different, but yet the outcomes seem different, dramatically different. And I'd like you first to talk about what was done nationally to perhaps account for some of those results.
Okay, I think the reason is threefold, three factors. One is, of course, the health insurance system here in Germany, which is a statewide coverage of medical care. And the second is when we heard the first reports from northern Italy and later on Spain, we did very drastic precautionary maneuvers, like shutting down our routine elective program, which happened nearly 4 weeks now before. And so we are just doing emergency operations and cancer operations and transplants. So by these means, which I have to mention was nationwide, by these means, we were able to shut down elective operations and to liberate intensive care capacity. This is one thing. And the other aspect was we were able to train our people, the medical staff, being nurses or being physicians, to refresh their knowledge about intensive care treatment, respirator therapy, and so on. And the third factor was that we did very drastic restrictions for social contacts and so on. This is, I think, the reason why Germany has such a low mortality, which we are surprised too.
So it sounds like it was both the hospital system in terms of emergency surgery and retraining, freeing up space, plus nationally. Were these national restrictions in terms of stay-at-home orders? Was domestic travel curtailed in the train and airplane system going from Hamburg to Frankfurt or Munich to Frankfurt in terms of domestic travel?
Okay. These restrictions were done in two steps. The first step was it was prohibited to take part into gatherings of more than 10 people. Later on, it's restricted, and now it's restricted to 2 people. 2 people are allowed to be together in public except for families. And I think the restaurants, festivals, were closed 3 weeks ago. So it's a total shutdown of public life here in Germany. Total shutdown.
Certainly the German Surgical Society, of which I'm proud to be an honorary member, canceled its meeting, and I don't suppose that's happened in many decades. So as part of everything shutting down, through what period of time have the activities, at least in the medical community, first and then the public at large, been canceled? Through when?
Usually the healthcare system is a matter of the federal states. But in this pandemic situation, the federal health minister of the Republic of Germany took or achieved the right to issue an order that all these social gatherings had to be postponed, and that all elective surgery, for example, had to be cancelled, which has never happened before. So in order to increase the intensive care capacity. So for example, in our hospital, we carry 160 intensive care beds, and there's one unique feature. All these intensive care beds have respirator places. So it's not like in a usual hospital where 50% of the intensive care places are just respirator therapy usable. Here it's nearly 100%. And we, by shutting down the elective surgery, we were able to, let's say, free 60% of all intensive care capacity.
The question is, through what period of time? Does this extend through April, through May, through June?
No, this was in March. This was started in March and went to April, so it was a three-week period.
And now,
since the beginning of April, since the end of March, it's a total shutdown of public life.
Do you foresee when the shutdown will end? Has there been any plan as to when the shutdown will end?
Now, there will be a conference between the minister presidents, like your governors, and Mrs. Merkel tomorrow, where the main point is when to ease these public restrictions. I personally doubt that the restrictions will come now. I think they will wait another 2 weeks. But there are voices like the National Academy of Science of Germany, which have endorsed the idea of Durchseuchung. This means infection through all layers of the society, like what Boris Johnson in the UK had propagated.
Okay, so regardless of when that occurs, the healthcare system, I'm sure, is looking forward to how do we take care of the backlog of patients who've been waiting for their surgeries, and what is the role in Germany of routine testing, preoperatively testing every patient for COVID-19?
So our policy is we do test only patients which are symptomatic, where there might be a COVID infection. So we don't do a routine testing.
Do you think that may change when you start having more patients come into the hospital?
I'm not quite sure. I personally doubt it. It's a tremendous, let's say, expenditure of money. And I personally doubt it that we do a routine testing for all patients being admitted to the hospital.
It's a very interesting approach, certainly, because many people claim that the reason for control is better testing of patients and therefore better contact tracing and better knowledge of who should be sequestered away in quarantine. But yet Germany clearly is doing a great job without the routine testing and contact tracing by physical distancing, which is certainly
their rule was just to impose social distancing, and this has been very, very strict. So this maybe is part of the German mentality that they obey orders. So there was no question now. There are some voices now arising where they say it's a violation of the civil rights and so on, but these voices are very, very low.
So what advice do you have for us in the United States? At the moment, we have one super hot spot, obviously New York, but we have others certainly emerging, and unfortunately, they're in some areas which have big discrepancies amongst the population in terms of susceptibility, and those areas include New Orleans and Detroit. So what advice do you have for us in the U.S. to try to replicate what's happened in Germany, at least for the cities where it hasn't yet hit?
I mean, we cannot talk about New York. New York is a unique city, so it's very, very, I think it's very tough from my experience. I love New York, to, let's say, educate New Yorkers. So social distancing, I think, would have been very, very difficult. What I would do is probably the same measures which we applied here in Germany, let's say in the state of Florida or in Alabama, Mississippi, whatever, social distancing, and the hospitals should be prepared. I mean, there were horrible scenes in northern Italy or Spain when you had admissions of 10 to 15 patients requiring intubation and respiratory therapy per hour. And I mean, our system would collapse with this frequency too, in case, except for that you have done precautions like, let's say, free the intensive care units, extend the intensive care capacity, and so on. And this would be my advice for the states which have not been struck so hard like New York.
And then the last question I have for you is in terms of any medical treatment, because one of the topics that's being discussed daily is therapy for patients. Well, and the other corollary, of course, is prophylaxis. So some people are talking about hydroxychloroquine, prophylaxis with or without zithromycin, also as a form of treatment, also plasma or serum therapy. What is the status of both the pharmacologic and the plasma serum treatments or prophylaxis in Germany?
Okay. What we have propagated is vaccination against pneumococci to prevent a bacterial superinfection once you are hit by a COVID-19 infection. At the second point, the discussion about anti-malaria drugs is not very hot here in Germany. What we have as a trial now is an antivirostatic which was used in Ebola patients. There is a big trial all over Europe where Hamburg, I think, is the leading institution which tries this anti-Ebola drug. So far, till vaccination has not been developed.
Okay, well, that's very useful information. And I thank you for sharing this time with us and helping us out with your reflections. Germany has been unique, and I certainly hope that the situation there is sustained with a low incidence of mortality and good preparation and availability in the hospitals and in the intensive care units. You've done your homework, and I hope you can learn here in this country to do that same homework. I wish you and your loved ones continued health and safety, and look forward to seeing you in person when this pandemic is behind us.
Yes, for me too, and I wish you from all of my heart health and keep the spirit up, like the Americans always do. This is very important. Keep the spirit up.
Thank you.
Okay. Thank you.